My name is Siti Nurmunir Binti Asman. My matrix number is 20.1. So we want to present about case study 5, which is ovarian cancer Figo stage 3A2. For introduction, the cancer is in one or both ovaries or fallopian tubes, or there is primary peritoneal cancer and it has spread or grown into organs outside the pelvis. Refer to microscopic extrapelvis peritoneal involvement with or without retroperitoneal lymph node. Next is case study. This case study revolved around the chemotherapy regimen prescribed for a 57 years old female patient with Figo stage 3A2 ovarian cancer. The treatment combines two drugs, paclitaxel and carboplatin, which target and kill cancer cells. For pre-medication, Dr. prescribed granisetron, controller, Piriton, dexamethasone, and Mexalon. For chemotherapy, drug is paclitaxel, hydrocortisone, and carboplatin. This plan is done every 3 weeks to allow body to recover between treatments.
Hi, my name is Nur Emilia Jamaluddin and my matrix number is 2047. I will continue with patient history and chemotherapy plan. Patient history. This is a 57 years old woman diagnosed with advanced stage ovarian cancer, stage 3A2. Her body surface area is 1.81 m2. The treatment plan includes chemotherapy with two main drugs, paclitaxel and carboplatin. She will also receive medication before the chemo to help prevent common side effects like allergic reaction, nausea, and vomiting. Before chemotherapy starts, 30 minutes before, the patient is given 5 medications through intravenous to prevent side effects like nausea, vomiting, and allergic, such as granisetron for nausea, controller to protect stomach, Piriton is for antihistamine, dexamethasone for increased inflammation or allergy, and Mexalon anti-nausea.
Before starting chemotherapy, we must give pre-medication to help reduce side effect and improve patient comfort during treatment. Let me explain each medication used. One is IVB canistron 3 mg D1. This drug help prevent nausea and vomiting, which are common side during chemotherapy. 2 is IVB controller 14 mg D1. Controller protect the stomach by reducing excess acid. This help prevent gastric discomfort during treatment. 3 is IVB Piriton 10 mg D1. Piriton as an antihistamine to prevent allergic reaction that might occur due to chemotherapy drug. 4 is IVB Dexa 12 mg D1. Dexamethasone help reduce inflammation and hypersensitivity reaction. It also support the body in tolerating chemotherapy better. 5 is IVB Mexalon 10 mg D1. Mexalon give additional protection against nausea and vomiting, working together with granisetron for better control of symptoms. Now I will explain the procedure for preparing chemotherapy drug. 1 is prescription check. The first step is checking the prescription. The doctor must determine the correct type and dosage of chemotherapy drug based on the patient condition. 2 is prepare the drug in a clean area. Next, the drug must be prepared in a designated clean area, usually a clean room. 3 is gathering supplies. Then pharmacy staff will collect all necessary equipment such as syringe, glove, and IV bag. 4 is mixing chemotherapy drug. Some chemotherapy drugs come in powder form and need to be reconstituted with a liquid before use. 5 is placing into IV bag. After drawing the drug into a syringe, it must be careful transferred into IV bag or a special purpose cytotoxic plastic bag for delivery. C is double checking. The sixth step is double checking by the pharmacist. They must verify the dosage, label and patient detail to ensure everything is correct before sending the drug out. 7 is safety. Finally, the prepared drug is safely transported to the treatment area for nurse to administer to the patient following strict safety protocol.
My name is Nuri Yasira. My metric number is 2044. So I will continue with last slide about aseptic technique application. So what is aseptic technique application? The technique for manipulation of compound sterile product and parenteral preparation that prevent contamination. So we start with first technique, which personal hygiene hand washing technique. So before donning, sterile gown hand washing is done by practicing the 7-step technique with an appropriate disinfectant and clean water. So here the 7-step. Second technique is gowning. For gowning procedure, first preparation, which remove makeup, jewelry and watch. For head and face, wear a bouffant cap, face mask and wash hand using the 7-step technique. For glove, put a sterile glove. And next for body and respiratory protection, wear a hood if separate, jumpsuit, zip fully and particulate respirator mask. For footwear, wear booties over feet. And for layering, dispose of the first glove, wear chemo glove aseptically, then a disposable chemo gown. For final protection, put on surgical glove over the gown curve. And last, for the final check, use a full leg mirror to ensure proper fit and coverage. Next techniques is protective personal equipment. Sterile garments should be worn at all time when preparing and handling sterile preparation. First is sterile glove, non-lighting, powder-free, double glove, change every 30 minutes. Second is respirator mask, N95 and 99 preferred. Surgical mask only protect against powder, cover burns. And third is protective goggles, side-shielded goggles to prevent eye exposure. And last is gloving. So here the step of gloving.